For the most part, this is the case for most neuropsychologists, not all. But largely what you'll see for neuropsychologists, especially outside of hospitals and just in the community and private practice, et cetera, folks will come into the office probably just once for the
Mhm.
comprehensive, the big most of the day evaluation. And then we usually schedule a feedback for some time shortly thereafter, depending on schedules and whatnot. And so oftentimes we're only seeing people those two occasions. Um, there are some neuropsychologists, and this is, like I mentioned, this is more common in a hospital setting, like an inpatient rehabilitation setting or something like that, where you might have that cognitive rehabilitation or psychotherapy or counseling, more of the kind of emotional, psychological focused intervention can be delivered by a neuropsychologist or can be done by a neuropsychology. Typically, those are somewhat time limited kind of thing. So, up to a point, even cognitive rehabilitation, you wouldn't really need forever or indefinitely, but a 6 to 10 week kind of program might help somebody come up with generate a number of different strategies to compensate for memory problems, as an example. So really, regardless of the reason for the referral, the vast majority of times it's going to be an assessment and a feedback, and then that's likely it. But like I said, some neuropsychologists will have more regular follow-up. Oftentimes, because we're so assessment focused, we end up referring people to other providers for the actual, ongoing intervention. Um, uh, so for example, if someone has, depression or anxiety in addition to their cognitive issues, um, uh, I might a referral for specific psychotherapy might be one of the next steps for them, and that wouldn't be necessarily with me. That'd be with someone who does that more consistently or more regularly.